The first case example that we're going to look at is that of Harry. Harry is 80 years old. After his wife died, he was finding it more and more difficult to cope at home, becoming forgetful, leaving the gas on and wandering out in the streets. So a decision was made to move him into a care home, and he's been in your care home for about 6 months. You've noticed that he's not been eating or drinking much for the last week, as the anniversary of his wife's death is approaching, and he's not able to sleep at night. Harry's medical problems are dementia, arthritis and high blood pressure, and his medications are donepezil, amlodipine and paracetamol. He has no recorded drug allergies. So given what I've told you about how Harry's been doing over the last 1 to 2 weeks, what do you think might be going on with him? We're going to now use the Is My Resident Well questions to make an assessment of what we think is happening and how we might respond to that. If we start off with his breathing, there doesn't seem to be any major concern here, so we can move on and look at his bowels. On the Bristol stool chart, it's noted to be a type 1 stool. In terms of hydration, it's been noted that Harry's not drinking very much at the moment, and his urine is a type 6 according to the chart. Harry doesn't report to be in any kind of pain, and he doesn't appear to be more confused than normal. However, there are concerns about his well-being, including his low mood and including the fact that his sleep has been disturbed. Finally, there are no concerns at the moment about his skin condition. So from our assessment so far, I would suggest that the 3 main areas of concern here are bowels with constipation, not being hydrated enough, and concerns about his well-being. Possible reasons for Harry's change in behaviour are infection, depression, or possibly that he is deteriorating as part of his general frailty and is nearing the end of his life. Whilst the problem is being looked into, we need to monitor him over the next few hours and days, looking for any worsening or new symptoms. So in terms of managing these things, the first step would be to obviously encourage Harry to drink more and to eat more. We're already going to be monitoring his input and his output and making sure that we don't think it's getting any worse. In terms of his well-being, the main thing that we can do at this stage is to talk to Harry and find out what's really going on for him. How's he feeling? Is he aware of the anniversary of his wife's death as part of the problem here? Obviously, if we feel like he's in quite a severe depression, then we might need to get the GP to come and review and think about whether he needs an antidepressant. So later that evening, around 8 o'clock, you notice that Harry seems a bit more confused and has wet himself as he couldn't get to the toilet on time, which has upset him quite a lot. He's talking as if he can see Mabel, his wife, in the room, and his urine smells very strong. So given this new information that I've given you about Harry, what do we think might be going on with him now? Because it marks a change from what was happening before, we need to use the assessment tool again and go through all of the questions so that we can work it out. So starting with the breathing, again there are no new concerns here, so we can move on to think about his bowels, which remain a type 1 on the stool chart. Unfortunately, his fluid input is still quite low, and so his hydration remains a concern. As we know, his urine is now smelling strong and it remains quite dark, number 6 on the chart. In terms of pain, Harry still says that he's not in any, but we have noticed that he is more confused than he was before, and there are possible hallucinations here as he's talking to his dead wife in the room, so this is a concern for us. The concerns about his well-being, his possible depression, his low mood remain, and these haven't yet been sorted out. And then finally, there are no problems with his skin at the current time. And so if we pull all of this together, I would suggest that the areas of concern at the moment remain his constipation, hydration, and his well-being, with a new addition of confusion. Overall, I would suggest that this is a picture of a possible urine infection because of the new incontinence, the fact that his urine smells strong, and the fact that he's more confused than he was before. So at this point, important things to do would be to take a sample of urine for testing. It would also be a good idea to measure his temperature, his pulse, and his blood pressure if that's available, and that's to see whether he has any signs of sepsis that we mentioned earlier. If there were any signs that the infection was very severe, then obviously we would need to get urgent help by either calling 999 or asking for a rapid response within a couple of hours. If Harry's temperature and pulse are normal, then it would be reasonable to call the GP, and at 8 o'clock in the evening it would need to be the out of hours service, and so we would call 111 *6. So in preparing to call 111 and speak to the doctor or nurse, it's useful to use the assessment tool SBAR that we mentioned earlier on. So in this instance, I would describe the situation as follows. Harry is an 80-year-old resident of my care home, and he has become confused and incontinent of urine. In terms of his background, he suffers from dementia and high blood pressure, and he's been in the care home for around 6 months. My assessment is that I'm concerned he has a urine infection, and my recommendation is that I would like somebody to come out, test his urine and possibly prescribe some antibiotics.